Cancer. The very word sends shivers down the spine of most people. According to the WHO, almost 8.2 million people all over the world die of cancer. That's almost 1 in 8 deaths.
Advancements in science like tumor genome sequencing have helped identify genetic mutations that drive cancer. This has helped bring about drugs and specialized treatment protocols that help kill these cancer cells.
Now, tumor biopsy is an essential part of treating cancer. But the problem is, it's an invasive procedure and it's often challenging in difficult to reach places like the pancreas or the brain.
Research has now brought about a new technique called liquid biopsy that is not only less invasive, more precise, but also helps personalize cancer treatment.
So today, let's talk about liquid biopsy. Welcome to Doctors on Call. I'm Dr. Sameer Gupta.
And I am Dr. Sonia Lal Gupta. Cancer is the uncontrolled growth of cells that spreads in the body. Treatment options include surgery, chemotherapy and radiotherapy depending on the stage and type of cancer. Tumor biopsies confirm a cancer diagnosis. The tissue samples are also used to check for genetic mutations to help choose targeted therapies for treatment. But reaching the particular site for a biopsy can be difficult in some patients. To overcome these difficulties, a new technology called liquid biopsy has been developed. Cancers shed tumor cells containing genetic material like DNA and RNA into the blood. Liquid biopsy is basically a blood test to look for these tumor cells and pieces of DNA that can help identify the type of cancer, all the associated mutations, and also monitor its treatment.
Just imagine, all they're doing is a simple blood test. Not only does this make the procedure less invasive, but it is also something that can be repeated during the course of treatment. In June 2016, the FDA in the United States approved the first liquid biopsy for use in cancer. This simple blood test is right now only used for detecting mutations in people with advanced lung cancer. To understand more about liquid biopsy and its research, we spoke to Dr. Gupta.
So liquid biopsy is a very simple process. It involves a blood draw or sometimes even collecting a urine specimen and testing that for circulating tumor DNA or microscopic circulating tumor cells which are actually shed into the blood by the tumors which are present in our body. We then subject that specimen to genetic analysis to try and identify what are the defects in the DNA which are actually causing the cancer. At the current time, liquid biopsies form the backbone of a very important trial which is going on in the United States known as the MATCH trial. And MATCH stands for Molecular Analysis for Therapy Choice, where you perform liquid biopsies, you identify the mutation which is there in that cancer and then pair them with a wide variety of drugs which can target those mutations, hence increasing the number of options for treatment for these patients. Keeping in mind liquid biopsies is to try and understand the dynamicity of the cancer. We do a liquid biopsy before the patient starts on treatment and then when they stop responding to treatment. That way we can compare what is the difference in the genetic makeup before treatment and after treatment to try and understand how is it that cancer outsmarts us and our drugs. Disadvantages of a liquid biopsy is we don't know how to process all the information that we get from it. Certain mutations we know of, certain mutations in association with that cancer we don't know of right now. The other drawback is the fact that it's still an expensive test and is not available to the general masses, at least at the current time.
Liquid biopsy gives us doctors a unique opportunity to better understand and treat cancer and also monitor its response.
Absolutely, Sameer. And even though research is still underway before liquid biopsies can routinely be used to detect cancer, this is still a big step in the right direction.
Absolutely, and I do hope that one day we do find a cure for this devastating disease, and when we do, we'll keep you updated.
See you next week.